Welcome to yet another interesting topic today. So, let me start with a brief intro. So, India is entering the era of medical weight loss with new generation weight loss drugs like Wegovy, Ozempic, and Monjaro promises 15 to 20% of weight loss, making headlines. And the promise of shedding this 15 to 20% body weight is real, but so are the risks, costs, and confusion. Are we treating obesity or medicalizing the fat? As hype gets on building, India must tread carefully, and a recent public interest litigation has raised red flags about misleading advertisements and the aggressive push by pharma companies urging regulators to intervene. So, this patient centric focused webinar by ETHealthWorld with the topic weighing in the rise of weight loss drugs in India brings high profile experts together to cut through the noise with clarity, caution, and clinical insight. So, today we have doctors from various facets who are specializing in various fields. Like we have Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute, who has joined us. Thanks a lot, Dr. Seth, for joining in, taking your time.
So, sir, we were actually trying to get some expert views on the impact that the weight loss medications are going to make on patients, how the paradigm of treatment is likely to change. Dr. Shashank Joshi mentioned to us about 200 underlying conditions that obesity leads to. It's the mother of so many diseases. Dr. Lakdawala also mentioned about the segregation of how, beyond 27 BMI, what are the options that we have. So thoughts from you, sir, about the cardiovascular implications. We know semaglutide also comes with a 20% reduction for MACE. Any thoughts from you?
Yeah. These are very important thoughts, and I think they've really given a lot of insight into especially, the most recent glucagon-like peptide inhibitors, receptor agonists. It's getting clearer and clearer. We know that in our own country, more than anywhere else, obesity is on the rise. And it's become not just a topic of information, it's become a topic of concern to the extent that even our Honorable Prime Minister raised this issue. And the facts are true. 35% of our population is either overweight or obese. And by the way, when we talk about the BMI, we're talking about different BMI figures than compared to the West, obviously. Even 25 milligram per square millimeter is 25 kilogram per square millimeter is an important aspect of our BMIs and obesity, because we're smaller frame individuals. We have higher risk of cardiovascular disease. And there's no question that obesity, which is a lifestyle disorder at the moment, is leading to majority of the problems that we see as far as cardiovascular, peripheral vascular disease, diabetes, hypertension, and other problems are concerned, be it musculoskeletal, be it even neurological. For once, we've got a drug which clearly reduces weight and therefore is not just a fad, but in people who are overweight, and I must qualify that, for people who are overweight and fall in the BMI index, by the way, the Western study has been done over 27 BMIs, lead to reduction of cardiovascular events. There is no question around that. And I think that's very powerful. They lead to decrease, they increase for people who got peripheral vascular disease. Again, major studies got proven. SELECT trial was one of the most recent studies which was talked about where remarkable improvements were seen. And in peripheral vascular disease, 6-minute walking test. That is amazing. Nobody could ever believe that you could have peripheral vascular disease benefits in terms of claudication, in terms of walking with these drugs. So what we see, of course, is that for people who need to reduce weight because of medical reasons, and I want to specify that, because of medical reasons, it adds on a huge benefit with low incidence of serious side effects at the moment. We have certainly longer term studies, and obviously these outcome studies are always long term. Does it mean how long a use of this drug, indefinite use of drug? We will get into that later with all our experts which are around. But I think it's getting more and more important for our own country. I would say that very clearly. where coronary artery disease and lifestyle disorders have increased immensely, where heart attacks have grown 300% over the last 20 years, where diabetes and hypertension have increased immensely, where even our children, 25% of our school children are overweight or in the obese category, we would see, hopefully in times to come, be able to decrease, at least to an extent, the outcomes for many of our patients. And then
Sure.
that's, and I must say, we had to resort to bariatric surgery. Diabetologists, endocrinologists resorted to desperate cases of uncontrolled diabetes by bariatric surgery. I think Dr. Joshi would be one of the first ones to say that the bariatric surgery, even in his own practice for control of diabetes, is practically disappearing as a management strategy for people who are overweight and have uncontrolled diabetes or lipids or even manifest coronary artery disease. And by the way, we must also re-emphasize all this data relates to overweight individuals with high BMIs who already have existing coronary artery disease. It is not data for prevention, I must say. It's data as a treatment strategy. And it's not indefinite. And while it's being used as a drug for weight loss, as in terms of appearances and in terms of the sake of looking better in the short term, maybe that's a small proportion of its use, or an important proportion of use, because once people get on to looking better, then they are more incentivized to maintain that through lifestyle modifications. And for them, I would say this would not be a long-term drug. That would be a short-term agent to incentivize them to be able to then get to lifestyle modification. There are some who can't just lose weight and have this barrier, and they will need to make the first barrier to lose weight, and then they can get to lifestyle modification. Well, I think it's a helpful strategy in those patients, those people as well. I think I don't call them patients.
Right. A great start to a discussion that we were actually expecting to be very exciting.
Specifically want to talk about the Wegovy one, which is recently launched in India. So Dr. Seth, I would want to ask about with Wegovy now approved to reduce cardiovascular events is what they have been telling us. So do you believe that obesity conversation is it shifting from lifestyle to mainstream cardiac care? Could this redefine, or how do we integrate obesity treatment into heart disease management in India? You've been doing it, but in the point of view of these drugs coming in, Dr. Seth.
Having put everything into context that this is a prescribed by specialist medication, let's start understanding Wegovy is semaglutide. And we've got injections, we've got tablets of semaglutide. And we want to understand, so Wegovy is the trade name, so we just stay away from that and just talk about these drugs. So semaglutide itself, very recently, of course, has undergone not just trials in diabetic space, who are anyway high risk for coronary artery disease and so on and so forth, but we're just talking about patients without diabetes who had coronary artery disease and were therefore high risk for cardiac events and were overweight. To the extent that multiple trials are now demonstrating, and SELECT was one of the best. More recently, SOUL-CV was also presented. These are in patients who are at high risk. Each one of them demonstrating the same over a period of 2 to 3 years, demonstrating cardiovascular benefits and hard endpoints: death, MI, cerebrovascular accidents. These are hard endpoints. These are not soft endpoints of, just a bit of drop in pressures or, better control of diabetes. This is talking about what we call survival. And when this drug starts showing advantages in that, and by the way, all these are supervised, obviously, these are trials, and these include specifically, that's why I want to be so clear. These are not trials being done on anybody who has coronary artery disease, but people who are overweight, obesity, which itself is a risk factor, and therefore in large BMIs. When they show benefits, the American College of Cardiology, very recently, exactly 2 weeks ago, has come out with a clear statement around semaglutide based on the drug. And it's not just therefore an add-on drug for us. it's now become a first-line agent. First-line agent along with lifestyle modification. Because as you can understand, a lifestyle modification in an overweight, obese person, high BMI, greater than 27 kilogram per millimeter square, takes its own time to get down to the correct weight. And he may be very frustrated. But each time that we don't get him down, we are putting him at a continued risk of cardiovascular events. Looking specifically at those patients, for us, it's become a first line agent to say, you're overweight, you already have blockages, you've had a heart attack, and you say you can't get your weight down, we'll help you to get your weight down. And for us, start your exercises, start your weight, and here's a drug. And I would then refer him to my colleague, endocrinologist, say, we'll put him on this drug because we want to improve his outcomes, we want to decrease his heart attacks, we want to improve his survival. Till a time that we get him down to the optimal weight. The real question is, do we continue him forever? Probably not. In fact, obviously not, because we still do not know the consequences of indefinite. Perhaps they may be safe, but obviously no drug is safe, not even a paracetamol tablet. And therefore, when we look at these, we say pharmacovigilance is best done by the person who prescribes it for a purpose, which is decrease in weight. And if that is achieved, can that person, that my patient who has coronary artery disease, previous heart attack, was overweight, has he got enough lifestyle modification into him now that I can gradually withdraw this drug gradually over the next few months so that he's able to maintain that optimal body weight, which therefore has resulted in improved cholesterol levels, that has resulted in control of blood pressure, has resulted in control of diabetes, and more importantly, we may be, from there on, we will be transfer him to good, healthy lifestyle, of which he's now become an integral part of. So yes, it is a first-line agent, and I want to emphasize that a first-line agent for people at high risk, but not necessarily an indefinite long-term agent.
So I'll try to wrap up all the key messages that have come. So I remember the first point that I think was from Dr. Joshi. He was very categorical. These are prescription drugs. Do not even go to the point of self-medication. Dr. Lakdawala mentioned that these are not the drugs that really work solo. It requires a holistic treatment of patients. And of course, the one that really stays is that, it's a disease-modifying agent. Do not call it a weight loss and trivialize the whole situation. Of course, there are multiple benefits that will come as trial data comes out. We had some very good questions, one of which was about whether it really works on fatty liver. I think trial data is still awaited, but yeah, a lot of action is due. Again, this is something that we will be treading very, very cautiously, and we'll keep coming back with the right messaging so that, people do not land up with problems. We have seen such disasters happening in some of the countries in the US, of course, and also in Europe. But hopefully we'll keep coming back on the right messaging, and with help of international level doctors like Dr. Joshi, Dr. Lakdawala, Dr. Ashok Seth, I think we'll be able to send out all the appropriate messages. Thank you so much again. I think this is a great conversation, and always grateful to all of you. Thank you so much.
Thank you. Bye-bye.
Thank you so much to all the doctors.